All right, so we also have our new long-acting injectable Lenacapavir, which is our every 6-month injection. So what comes with our Lenacapavir kit is going to be 2 1.5 milliliter vials of Lenacapavir. You're going to get 2 syringes, 2 types of needles. You're going to get a withdrawal needle to pull up the medication and also an administration needle. So you want to make sure with this that when you're drawing up your medication, you're making sure that there's no discoloration, no particulate matter in there. It's not expired. Just want to clean that off with your prep pad. And you're going to take your larger gauge, shorter length withdrawal needle and attach that to your syringe. And because this is going to be a 1.5 milliliter injection, we can draw up 1.5 milliliters here. Let's see, drop 1.5 milliliters. There we go. Attach that withdrawal needle. And go ahead and inject that air. And let the other 1.5 milliliters draw up. It's going to look like a yellowy, syrupy consistency medication. So once you have that, you can go ahead and guard your needle. You have your dose, and this needle can be disposed of in your sharps container safely. And then you're going to go ahead and attach the actual injection needle that comes with the kit. And that is 1/2 of your dose. The full dose itself is going to include another 1.5 milliliter syringe of the same medication from a different vial. So essentially, you're going to repeat those steps to make sure you have 2 of these. When you see your patient, we have Miss Rosy Cheeks here again. We're going to do our hand hygiene. We're going to do our gloves. And we're just going to look over our patient to look for any sites where we can give a subcutaneous injection. So for this medication, that's going to mean any adipose tissue near the abdomen or in the thighs. In this case, our patient is pretty lean, so we're gonna have to probably avoid the abdomen today and go more so with the thighs. So we have our prepared medication, we have our alcohol pad, our gauze pad, and our Band-Aid. And so you find your site, you wanna make sure there's good subcutaneous tissue there. Really think about same concept as a insulin injection, where same sites you can give that as well. You want to pinch broadly that subcutaneous tissue, wipe that down, and let that dry. And as that dries, you can go ahead and pull off that guard. Pinch that skin, and you want to go in at a 90-degree angle to get into the sub-Q tissue, but no less than a 45-degree angle to make sure that we are really getting into the sub-Q tissue there and the drug depot forms. So get into there, go ahead and inject slowly because this one is also viscous and it's going to feel a little syrupy and give some resistance. So go slowly over a minute for the patient, and then as you withdraw, go ahead and release the skin. If there's any leakage of any kind, you can go ahead and put that gauze pad over it to block that and make sure you guard your needle and dispose of that safely. We will go ahead and draw up and get our Band-Aid so we can place that right over where we put our injection. And then we have the other half of the dose, the 1.5 milliliters, to give in another subcutaneous spot. So since we use this thigh, we can use the other thigh, or if the patient has enough subcutaneous tissue in the abdomen, we can give it anywhere 2 inches away from the navel. And you just repeat all those steps, and your patient can schedule for the next 6 months. Thank you.